Hi, my name is Stephanie Wise, and I'm here to give the 2019 commencement speech for the 2019 nursing graduates. I'd like to speak to you today regarding the wide world of nursing and how it came about and works in our world. Back in 1820, Florence Nightingale was born in Florence, Italy. And during that time, back in the 1800s war, she developed some sanitary techniques and which decreased the death rate. She also established the St. Thomas Hospital in 1860, and she also developed the Nightingale School of Nursing. Usually when you start out in nursing school, you start out with the CNA experiences along with learning the CNA skills. So it takes a village to start out with the nursing. During my nursing career, I started out as a CNA, went to CMA, and then became an LPN. In the ideal world, there are no interruptions, no emergency, and no time constraints. As you enter into the world of nursing, there is the real world versus the clinical world. And as you go about, you learn how to deal with the real world, interruptions, emergencies, and time constraints. The CNAs are your eyes and ears. And the most important advice I can give to you is to always be honest, put safety first before anything, and always trust your gut instinct. Honesty is very important for building integrity with your coworkers and with the patients. Safety is obviously important due to the safety of the patient as well as for your coworkers as well. And always trust your gut instinct. Sometimes you can't always pinpoint something is going on with the patient, but you just have to go with the flow and hope that your gut instinct is correct. Your coworkers are very knowledgeable. You can trust their advice. As a new nurse, you always want to find that one nurse that you can trust, that's been an experienced nurse. Always put your patient first, and like I said before, always be honest. During the course of your nursing career, you're going to make mistakes. And honesty, as you're building your integrity, will go well with that mistake as well. Unfortunately, we can't always predict what mistakes we're going to make. A calcium error versus a Coumadin error is obviously going to have different consequences. We hope that we're the nurse that makes the calcium error versus the Coumadin error. You're always going to have that doctor that you don't want to call no matter what. And you're always going to have that doctor that's going to scream over or through the phone at you, and you just thank the Lord that he can't come through the phone. And you're always going to have that doctor that you don't care. He's always going to be like, okay, I understand you made a mistake, you're human. Unfortunately, as a nurse, we're expected to be perfect. But we are human, we do make mistakes. And hopefully our patients and medical personnel will understand that, especially for our new nurses that are going out into the world. Don't forget where you came from. Many of us were CNAs, like I said, before we became nurses. Like I said, your CNAs are your eyes and ears. Show them the appreciation that you would want to receive as a CNA. Their job is not easy. Of course, neither is ours, but they don't know what we go through every day. They only see in their own perspective what is before their eyes. They see us passing meds. They see us using our stethoscopes. They see us sitting down at the desk. They don't see that we're thinking in our head logically, now what am I going to do? You know, we're looking up things for our patients. We're faxing doctors. We're prioritizing. But in their eyes, it's a nurse sitting behind the desk, not helping them. Your CNAs are very vital for being a good nurse because we can't always be on the floor. We're not in direct contact with our patients. Be the nurse that you want to work with. Don't be the nurse that sits behind the desk drinking their pop and eating their lunch or snacks throughout the day, where you see your coworker out there working their tail off and can't keep up or are drowning in paperwork. And most importantly, trust your gut instinct. If something is out of the, for you new nurses, if something is out of the ordinary, you probably should be charting on it, or you probably should be doing some sort of intervention. If you're called into court, they're going to ask you, what was your intervention? What did you do? The world of nursing is a tough career to be in, but it's very rewarding. And I promise you that if you put everything into being a nurse, that you will reap the rewards of the career that you have built. Thank you very much.
Yeah.